So let us start the another practical of the pharmacology class, and this is the performing practical class. So you have to perform in the lab. But here I'm going to discuss only the theoretical part of the practical, and when you have to reach to the campus, then we have to discuss through the preparation. I mean, you have to dispense in the lab. So now we have to start a next performing particle after the ointment, and the name of this one is compounding and dispensing of the powder. So that we are going to discuss compounding and dispensing of the powder. So first we have to define the powder. I think you all have seen the powder, and if you have seen the powder, this is very easy to define. First you have to go through the form. So how it look? It look dry. So this is the dry form, and this is in powder form. So if you have seen the physical property, I mean the consistency, you have to define that powders are finely particles in which the mixture of drug or chemicals are in dry form, and that we have to use both internally as well as externally. So now the definition is completed, is called powder. So powders are finely divided granules in dry form and used for both the internal and external purposes, is called powder. So this is the definition. Even though you forget the definition, only you have to recall how the powder looks, how the powder seems. You will only accumulate these looking things, and then you have to define the powders. So now we have to go through the types of powder or dosage form of the powder. You can say the dosage form of the powder as well as the types of powder. So there are only two types of powder, that is bulk powder and divided powder. So this is two type. Bulk powder, that means ki in that there is no division of the dosage. So that is why they are called bulk powder. And in divided powder, you will have in divided form single dosage form. So that is why this is called divided form. So if you go through both separately, then bulk powder is bulky and used for both internal as well as the external use of the bulk powder. So bulk powders are available both for the external use as well as the internal use. Internal use bulk powder is called oral bulk powder, whereas external use powder is called dusting powder. So external one is called dusting powder, and internal use bulk powder is called oral bulk powder. So this is the meaning of bulk powder, and this is divided into two based upon its utility for external and internal. Now again, dusting powder is subdivided into two parts. That is the external one, that is the dusting powder, is again divided into two parts. based upon its utility. So when you are using on the wound cavities, then this is called surgical dusting powder. And when you are not going to use over the wound body cavity, that is called medical dusting powder. So this again divided into two parts, medical and surgical dusting powder. Now we have to go through the dust divided powder. Divided powder is only used internally. So this is very, very important that divided powder is used internally and is single dose. Is we are preparing it single dose, used internally, and the dose in single dose should not be less than 120 milligram. So, if this is a divided powder, so this is a single dose. So this is the single dose. In this paper, you have kept a powder. So this is single dose, and this is used orally. I mean internally, and this is should not contain the amount of single dose powder should not be less than 120 mg is called divided powder. Now you have to see one by one. So we already explained bulk powder for external use is called dusting powder that we already discussed. Dusting powder again divided into two part, medical dusting powder and surgical dusting powder that we already discussed. The medical dusting powder is used externally, but it should not be applied over the wound or body cavities, and the example is prickle heat powder. The powder that used for ghamori is called prickle heat powder. Prickle heat powder. And next is the surgical powder. Is we are going to use it on the wound. Umbilical cord in the case of kid. We are going to use in the body cavity. And the best used one dusting powder that is called surgical dusting powder is soframycin dusting powder. So this is very, very important dusting powder. Now we have to go through the that we already discussed. So this is fast. You apply medical dusting powder. You apply superficially on the skin, and this is very fine. So powder we already discussed, very fine powder, and that we already discussed should not be used on open wounds or broken skin. And the example is prickle heat powder that we already discussed. Also, we already discussed the surgical dusting powder, and they has the most important thing regarding the surgical dusting powder is that it should be sterile. Why? Because we are using it in the body cavity, in case of burn, in case of major wounds, in case of umbilical cords of the young ones. So these all are indicating that if you are not going to use the surgical dusting powder as a sterile, then this is going to create the infection problem. So surgical dusting powder, bulk powder should be sterile. This is the primary criteria, and we have to use the places that we already discussed. Now we have to go through the divided powder that we already discussed this also. The divided powder is mainly for the internal use and is for single dose and is wrapped in the paper. Single dose is wrapped in the paper properly in properly folded packet, and each dose should not be less than 120 mg. So this is very, very important. And the last one, if a powder is possessing divided powder, not powder, divided powder contain more than one ingredient or constituent in preparation is called compound powder. So this is important one. So now we have to go through what are the disadvantages the powder have, what are the advantages the powder have. So first we have to go through the advantages of the powder. So the shelf life of powder is more as compared to the dosage form in liquid like solution, like suspension. So shelf life of powder is more than those dosage form that are in solution, usually like the suspension. And powder is easy to administer when you are comparing this with the tablet, when you are going to compare with the capsule, and when it reach in the gastrointestinal tract, it disperse over the surface area and it will cover more area, and therefore the absorption is more or faster. The dosage is convenient to dispense in large dose. So this is very, very important, and also convenient to administer the crude vegetable drug. So when you are drying the vegetable and making it powder, so in this form, this is easy to administer this crude vegetable form. And why this is we are doing by this powder? Because this may be insoluble, and when it get become wet, I mean if the vegetable get drug get wet, then the microbial decomposition of the vegetable drug will start. And this is also the one of the more also important advantage is this is also used for insoluble type of drug. So these are the advantages of the powder. Regarding disadvantages is concerned, disadvantages is also there. So disadvantages are the powder is too bulky. So bulkiness is there. Disadvantages are that this is bulky in is nature. And when you are taking in it in a packet, this is easy to spill, easy to spill. So this is another important point. The bulky disadvantage, easy to spill when you are opening it, and compounding or preparation is time consuming. So this is important. Second important point is that you are not able to go to make the powder for potent substance, because potent substance, when you are going to make it in the powder form, if the some doses patient is going to take more, then it will cause toxicity. So potent drugs should not be or avoid to dispense in a powder form. So this is going to produce the dosage inaccuracy. That is why this is the region. This is another region, other compound like volatile compound, like hygroscopic compound, like oxygen sensitive compound are not ideal for making the powder. Why? Because if the compound is volatile, if you are going to make it powder, it get volatilized and escape out. When this is hygroscopic, when while making the powder, it is going to absorb the water from the surrounding, so it become wet. If this you are making it powder form, and if the compound is oxygen sensitive, more surface area is available to oxidize, so therefore also this is not good. So these are the disadvantages of the powders. Now we have to go through the different powder that we have to perform in the lab in the practical class. So first you have to make the dusting powder. Then we have to go through the divided powder. So in this we are going to prepare the medical dusting powder. So what is difference between medical dusting powder and surgical dusting powder? This is coming under the category of bulk powder first, and this should not be used in the body cavities or wound or broken skin. And the best example of this is boric acid dusting powder. Why the name is dusting powder? Because this is in dusty, very fine particle. That is why. And this is bulk. So boric acid dusting powder. So here, if you go before going to go through the composition, if you are recalling what is the name of the preparation or powder preparation is boric acid, that means the one main constituent should be boric acid. So here all the constituent under the boric acid powder are 30 grams. So 30 gram you are going to take each. In these two, the starch and talc are taking the vehicle form to increase the amount. So this act as a starch and talc act as a vehicle form, and other than that, the two other main constituent of this preparation, boric acid powder dusting powder preparation, medical preparation, boric acid. Boric acid is antiseptic in nature, whereas zinc oxide not only antiseptic but also astringent. So what is astringent? When you are going to put S, this become astringents. So astringents are the agent that we already discussed, are the drug, are the compound, are the material which is going to precipitate the protein. Precipitate the protein. So that is called astringent. Now, whereas the starch and talc is protecting as well as soothing in action. So how we have to prepare? Procedure of preparation of the boric acid dusting powder is that you have to weigh all the ingredient, keep in the mortar and pestle, triturate individually, then mix it and then triturate together to make a preparation that we are calling it as the boric acid dusting powder. And this is not for internal use. So usually this is called bulk dusting powder, and the use over the skin. So use externally over the skin for various skin condition like ghomori, like that. Other infective condition, there we have to give this one. Now we have to go through two more preparation, and these two preparation are coming under the example of divided powder. So what is divided powder? So there are two type of powder, divided powder and the bulk powder. So divided powder is only or mainly for internal use, whereas the bulk powder is used for both externally and internally. So externally, bulk powder is called dusting powder, that is medical and surgical dusting powder, bulk powder. Now we have to go through the divided powder. So divided powder, first we have to go through the anti-acid divided powder, and we call it triple carbonate divided powder. So triple carbonate dividing powder is an anti-acid used where we are going to say for the dog. Now we have to go through the composition. This composition is for the single dose, one dose preparation, and its amount is should not be less than 120 mg. So now we have to go through the triple carb. So triple carb means ki three carbonate. Three triple carbonate means three carbonate. So three carbonates are present. Because this is the antacid, so soda bicarbonate must be there. So first component, important component is soda bicarb, and all the constituent are ingredient are 0.3 gram. So soda bicarb, bismuth carbonate, and magnesium carbonate. These all are used. How we have to make the procedure of preparation? We have to weigh the ingredient and keep in the mortar pestle, triturate and eat, and now again wait the other ingredient, mix it and triturate it, and you have to use it. So what is the function of this? Soda bicarb is an antacid, particularly systemic antacid. So this is used for systemic antacid action. Bismuth carbonate is both sedative and astringent. Sedative means it will keep the movement calm. So animal become calm and quiet. So if the peristaltic movement is more, it will reduce the peristaltic movement. So now the astringent that we already discussed, this is going to precipitate the surface protein. So when you are going to give it orally, this is going to precipitate the protein, that is particularly the mucosa, and it will inhibit the further absorption or reduce the rate of absorption that the bismuth carbonate is going to do. The last carbonate is the magnesium carbonate. This is also an antacid but non-systemic antacid, as well as this is laxative to pass out the stool, gastric sedative to keep the animal calm and quiet. So this is about about the triple carbonate, and that we are going to use for the hyperacidity, gastritis, and hyperchlorhydria. Hyperchlorhydria means more HCl production is there. So this is about the first divided powder. Second and the last divided powder, we are going to discuss the oral rehydration powder, or also called ORS, oral rehydration salt. So this contains salt. So as you know, when there is diarrhea, when there is vomition, so more loss is of the ions, particularly sodium and potassium ion. So when there is more loss of potassium ion occur, this is going to create the muscle cramp. Muscle is going to cramp and you feel pain. So for that, if the patient is going through more diarrhea and as well as the vomition, rather vomition is more dangerous than the diarrhea, then you have to compensate by giving giving the sodium and potassium. For sodium, you are using the sodium chloride salt. For potassium, you are using potassium chloride, and also you are using the antacid soda bicarbonate. And we are going to use the last component is the glucose. So we are going to go through the one by one action of one by one. Sodium chloride is going to compensate the iron. Potassium chloride also going to compensate the iron loss, and the soda bicarb is a systemic antacid, whereas the last one is glucose. Glucose is going to facilitate help for the absorption of particularly the sodium ion from the intestine. Therefore we are using glucose, or we are going to use like compound like the sodium citrate in place of glucose. So this is all about the component used for the ORS, and this is very important. At least you have to know how to make the ORS mixture. So the same process of procedure preparation, and that we are you going to how use you when you have made the powder, keep wrap in and keep it, and when you are going to administer it in the patient, then you have to boil the water and cool the water. Once the water get cooled, boiled water get cooled, you have to mix with the ORS powder, and then administered orally to compensate the fluid loss and iron loss due to diarrhea and vomition. So this is about the seventh practical class, and we have to go through the this in the lab also to perform also. So this is all about your today class.